Dr. Kevin Kavanagh, Dr. K as we call him, is a retired physician, also the founder of a national organization called Health Watch USA. He joins us now. Good morning, Dr. K.
Good morning, Jack.
How are you?
I'm doing really good.
Well, President Biden expected to announce a change in the deadline for the vaccine eligibility for adults to receive the COVID-19 vaccine. That's been moved up to April 19th. The original deadline was going to be May the 1st. What does that tell you?
Well, it tells us that our vaccination distribution is really going gangbusters. Some people may think, well, people aren't getting the vaccine, so we're moving others up into those slots. But no, I think it's because we are vaccinating so many people in the United States. This weekend, we hit 4 million vaccinations per day. And of course, this is key to make sure that we have enough resistance in the community for these new variants and that we don't have another surge. As you know, I'm on the side of thinking that we may not have a surge. We're going to be like England, vaccinate our population and avoid what is going on in Europe right now.
And England doing a particularly good job in terms of offering free nationwide COVID-19 testing. Is that right?
Well, that's correct. And this is twice a week for everybody in their nation. So they're very serious about this. I mean, you can compare that to what's going on in our country. We're pretty lackadaisical on how things are going. As you know, last year I had talked about testing students twice a week, and that was not viewed, I think, very favorably. I don't think anybody does this. Well, here's England testing their entire nation. In the United States, in order to do this, we would have to be testing 50 million people a day. And that's to test them twice a week. And so this is a horrendous undertaking, but it does show the seriousness other countries are taking this pandemic. So let's take it seriously in the United States. Let's not mitigate the virus and let's get vaccinated. And Jack, just as an aside, I have a brother-in-law who has parents in Canada. For him to go to Canada to see his parents, he has to quarantine for 2 weeks. 3 days of that 2 weeks have to be in a special hotel at a cost of $1,000 a day. Again, Canada's very serious, and that doesn't matter how you enter the country. Okay, I'm going to say that on the front end. It can be whether or not you're coming in by ship, by plane, or whether or not you're coming in by foot in the southern border. You can spread the virus, and people need to be quarantined to make sure that if they're coming from an area where there's a variant, that this is not spreading into our nation.
We have a news story this morning indicating that Fayette County schools are going to stop having kids have to get their temperatures taken. Is that a good idea?
Well, I think it'd be a good idea to do testing at least twice a week to try to get a handle on this virus. Children do not get severely sick from this virus, at least most of the time. I mean, they can. There are certainly cases, but they don't get as sick as often as adults, but they do spread the virus. And with these variants, both in England and what we're seeing in the Midwest, is that the pandemic is being driven by the spread from children. Now, that being said, temperature checks do probably pretty little to catch this virus. There's a lot of asymptomatic spread, and this is very prevalent in young children. So you're only going to pick up a very small minority of cases. So I'm not sure if it isn't doing more to give us false sense of security in that cohort of patients than it is to actually picking up cases. So doing away with temperature checks to me is not necessarily a bad idea, but I sure wish we would expand testing. We need to do that in our nation.
Always good to hear from you. Thank you so much, Dr. Kevin Kavanagh.
All right. Thank you very much, Jack.